Have you been noticing unusual symptoms lately, but brush them off, thinking they're no big deal? It might be time to think again, because some of these signs could point to kidney failure. In this video, we're counting down the 12 shocking signs your kidneys are failing. These signs may seem unrelated, but together, they could be telling you that your kidneys are in trouble. By the end, you'll know what to watch for and how to take action before it's too late. Let's dive in. So let's start with one of the most common and overlooked signs. Number 12 is fatigue. Feeling tired after a long day is normal, but if you're constantly exhausted despite getting enough sleep, it could be a sign that your kidneys are in trouble. Your kidneys produce a hormone called erythropoietin, EPO. This hormone is responsible for stimulating your bone marrow to produce red blood cells. These cells carry oxygen to your organs, and when there aren't enough of them, you're left feeling weak, tired, and drained of energy. This condition is known as anemia. A study from the American Journal of Kidney Diseases found that anemia is present in about 50% to 60% of people with stage 4 chronic kidney disease, CKD. If you're living with anemia, simple activities like walking upstairs feel like climbing a mountain. Another thing to note is that fatigue from kidney failure can affect not just your body, but also your mind. If you've been experiencing this ongoing sense of tiredness, especially if it's coupled with mental fog, it's time to get your kidney function checked. Next on our list at number 11 are swollen ankles, feet, and hands. Kidney disease can cause your body to retain excess fluid, which often accumulates in your ankles, feet, and even your hands. This swelling, known as edema, happens when your kidneys are no longer able to remove enough sodium and water from your system. As a result, the extra fluid builds up in your tissues. Swelling from kidney disease usually starts in the feet and ankles, but can spread to other parts of your body if left unchecked. Your rings might feel tight on your fingers, or your shoes might become difficult to put on. This type of swelling is more common after sitting or standing for extended periods. Studies published in Nephrology Dialysis Transplantation indicate that salt reduction and managing fluid intake can help alleviate edema. If your swelling is accompanied by shortness of breath or chest pain, it could be a sign that the fluid has started to build up in your lungs, which is a medical emergency. Number 10 is shortness of breath, and this can be one of the more frightening symptoms. As mentioned earlier, when your kidneys are failing, excess fluid can accumulate in places it shouldn't, such as your lungs. This condition is called pulmonary edema and can make it incredibly difficult to breathe. In severe cases, you may feel like you're drowning even when you're lying down. But fluid overload isn't the only reason kidney failure can leave you gasping for air. Anemia, caused by the reduced production of red blood cells, can also contribute to shortness of breath. Your organs, including your heart and lungs, aren't getting the oxygen they need to function properly. Studies found that difficulty breathing is one of the most common symptoms in patients with end-stage kidney disease. If climbing stairs or even mild activity leaves you breathless, your kidneys could be the problem. Coming in at number 9, high blood pressure is both a cause and a consequence of kidney failure. Your kidneys help regulate your blood pressure by balancing your body's salt and fluid levels. When your kidneys are damaged, they can't remove enough sodium, which leads to fluid retention and raises your blood pressure. Over time, uncontrolled high blood pressure can further damage your kidneys, creating a dangerous cycle. According to the National Kidney Foundation, high blood pressure is the second leading cause of kidney failure, responsible for about 25% of all cases. On the flip side, kidney failure can cause blood pressure to rapidly increase, putting you at greater risk for heart attacks and strokes. If you have high blood pressure and it's resistant to treatment, it's worth checking your kidney function. Simple blood and urine tests can provide key insights into whether your kidneys are struggling. Number 8 brings us to one of the more noticeable signs: changes in your urine. Because your kidneys are in charge of producing urine, any abnormalities in its color could indicate a problem. You may notice that you're going to the bathroom more frequently, especially at night, or that your urine is foamy or bubbly. which is a sign of excess protein being leaked into the urine, a condition known as proteinuria. Another concerning sign is blood in your urine, which can give it a brown or red tint. This could indicate that your kidney's filters, called glomeruli, are damaged. The disease is called glomerulonephritis. Additionally, blood in the urine may also be a sign of kidney stones, infection, or even tumors. Studies show that changes in urine, particularly increased protein levels, often occur early in kidney disease, long before other symptoms appear. Pay close attention to what's happening in the bathroom. Your urine could be giving you important clues about your kidney health. At number 7 is nausea and vomiting, symptoms that often catch people by surprise. When your kidneys are failing, waste products that should be eliminated through urine start to accumulate in your bloodstream. This buildup of toxins, known as uremia, can make you feel sick to your stomach. You may find yourself feeling nauseous for no apparent reason, and in severe cases, you might even vomit. The constant nausea can make it difficult to eat, which leads to weight loss and malnutrition. Reports published in Kidney International highlighted that uremia-related nausea is common in the later stages of kidney disease, but it can be managed with proper treatment like dialysis or medications to control uremia. At number 6, we have persistent itching, and this is not your ordinary dry skin itchiness. When your kidneys aren't filtering out waste effectively, those toxins remain in your bloodstream. Since blood is just under your skin, it can lead to intense, itchy skin. This condition is called uremic pruritus. The itching may start as mild, but can become unbearable, spreading across your whole body. Studies found that about 40 to 84% of patients with end-stage kidney disease experience pruritus. This itching often doesn't respond well to typical lotions or creams, as the problem isn't dry skin, it's the buildup of waste products that your kidneys can't eliminate. The good news is, managing your kidney disease can help relieve this symptom. In some cases, dialysis can reduce the toxins that cause itching, but for others, additional medications may be needed. Moving on to number 5, muscle cramps, especially in your legs, can be another sign that your kidneys are in trouble. Your kidneys are responsible for maintaining the right balance of electrolytes in your body, like calcium, sodium, and potassium. When kidney function declines, these electrolytes can become imbalanced, leading to painful muscle cramps and spasms. These cramps are especially common at night and can interfere with your sleep. Muscle cramps affect a significant portion of people with chronic kidney disease, particularly as their condition worsens. If you're experiencing unexplained cramps, consult with your doctor about testing your kidney function. At number 4 is something that might surprise you: a metallic taste in your mouth. A declining kidney function can affect your sense of taste due to accumulated waste products in your body. You might find that food doesn't taste the way it used to, or you might even develop a metallic or ammonia-like taste in your mouth. This is also a sign of uremia, and it often goes hand in hand with bad breath. Studies found that many people with kidney disease lose their appetite or avoid certain foods because of this metallic taste. You'll need a lot of nutrition when dealing with kidney failure. However, this symptom can only worsen your overall health. At number 3, let's talk about something you might not immediately connect with your kidneys: trouble concentrating. When your kidneys aren't filtering out toxins efficiently, those toxins can build up in your brain, causing issues with focus and clarity. You might experience brain fog, difficulty concentrating, or even memory problems. This cognitive impairment can make it hard to get through the day, affecting your work, relationships, and overall quality of life. People with chronic kidney disease often experience cognitive decline as their condition progresses. It's important to note that this symptom might be subtle at first, but over time, it can worsen. At number 2, we have a decreased appetite. As toxins build up in your body due to kidney failure, you may find that you're just not as hungry as you used to be. This lack of appetite can lead to malnutrition and weight loss, which further weakens your body and makes it harder for your kidneys to function properly. Research published in Nephrology Dialysis Transplantation indicates that loss of appetite is common in patients with chronic kidney disease, especially as their condition worsens. If you find that you're eating less without any obvious reason, consider consulting with your doctor to check if there are problems in your kidney. Finally, at number 1, back pain can be one of the most telling signs of kidney failure. Your kidneys are located in the lower back, on either side of your spine. When they aren't functioning properly, you may feel pain in this area. The pain can range from a dull ache to sharp stabbing pains. Some people with kidney problems also experience painful kidney stones, which can cause severe discomfort. Back pain related to kidney disease is often confused with muscle pain or sciatica, but it's different because it doesn't go away with rest or a change in position. If you're experiencing unexplained back pain that doesn't seem to improve, it's important to consider your kidneys as a possible cause. And there you have it, the 12 shocking signs your kidneys are failing. Kidney failure is a serious condition, but the good news is that many of its symptoms show up early, which gives you time to act. If you've noticed one or more of these signs, consult with your doctor. Early diagnosis and treatment can make a difference in preventing further damage. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and don't forget to hit the bell icon to stay updated on all our latest content. Have you or someone you know experienced any of these kidney failure signs? Share them in the comments below. We'd love to hear from you. And if you enjoyed this video and found it helpful, please consider sending us a super thanks. Your support helps us continue to create informative videos that empower you to take charge of your health. Thank you for watching, and here's to your journey toward better health.